Not only are there concerns about administering the vaccine in a timely manner, but also making sure it's done fairly. WVTM 13's Chip Scarborough looks at the potential for disparities when doing so.
Properly collecting data from those who have contracted and even died from COVID-19 is critical in helping to ensure the vaccine is equally distributed.
We know that, for example, African Americans are twice as likely to contract COVID. Native Americans are 3 times as likely to contract COVID.
The only way doctors know that is through collecting data and accurately recording a person's race. The Alabama Department of Public Health's dashboard shows that 58% of the state's deaths were white, 28% were black.
If we look at some of the other states that are also reporting data in terms of death rates, I think we see similar type of numbers as it relates to percentage of the population.
But with the black community being at a greater risk for contracting the virus, should that be a bigger factor in determining who gets the vaccine first?
And, some people believe that issues of distribution should not be correlated with proportions of the population who are most highly impacted. Yet that is really the default approach we've been taking. For example, healthcare workers, first responders, educators.
Individuals with a higher chance of catching and spreading the virus, but there's another perspective in terms of how the virus actually impacts the body.
From a racial and ethnic standpoint, that you can't argue with the fact that African Americans, Latinos, Native Americans are disproportionately impacted in terms of both contracting the disease and unfortunately dying.
Supporting the argument, a vaccine distribution plan that doesn't account for that is not a fair and equitable plan. In Birmingham, Chip Scarborough, WVTM 13.